As an iBiomed student, you will have the opportunity to work with the various equipment housed in our very own medical instrumentation lab. In order to take part in labs, you must thoroughly understand the standard operation procedures, also known as the SOPs, to ensure overall success. The equipment present in this lab is specifically designed to be used for educational purposes. However, proper handling of this equipment is required in order to safely operate these devices. In case of any kind of injury, you must stop using the equipment and inform the lab coordinator immediately. It is important to note that the equipment in this lab could cause serious to fatal injuries if used improperly or for their non-intended purposes. Please always work with caution, as the equipment in this lab is fragile and extremely sensitive to mechanical shock, and always follow given instructions. In this lab, you will have access to an oscilloscope, digital multimeter, patient simulator, and NI-USB data acquisition system. In this video, we will go over health, safety, and cleaning protocols when using this equipment. The equipment in this lab is only to be used in the IBEHS Instrumentation Lab and not to be removed at any cost unless authorized. The equipment in this lab can only be used when a supervisor is present. Now we will address health protocols. Possible adverse biological effects could take place if the equipment is not used correctly. This includes the possibility of an electric shock hazard. In order to prevent this, always use a grounded power cord with all the equipment present in this lab. When using the equipment correctly, there will not be any kind of biological effects against your body. Any biosignals obtained during these experimentations using the ECG or EEG leads and electrodes is to be used for signal processing and testing purposes only. There won't be any clinical diagnosis or therapeutic treatment that will be done in this lab, and any such attempts might cause serious damage to the user. Lastly, do not connect the patient simulator to your body during this lab. Now we will go over equipment safety. Do not use the equipment with voltages or signals that are beyond the specified limits. Your instructor will communicate these to you. Before you perform any experimentation, ensure that the equipment is in proper condition. Stop using the device if any unusual signs may be noticed, and inform the lab coordinator immediately. Do not try to perform any service-related operations to any of the devices present in this lab, as this may cause serious bodily harm or damage to the equipment. Please pay special attention to the power cord and make sure it is not damaged or broken. In the chance that you find that it is broken or damaged, do not use it, and inform the lab tech. When handling the devices, always be in good posture to ensure that there is no bodily harm to the user, anyone around, or no damage to the device itself. Always place the cables and other electrical cords of the device in their designated slots. Do not drop the device on the floor or bump against hard surfaces, and do not overextend the cables connected to any of the equipment. Now that we went over equipment safety, we will be covering cleaning safety. Do not spray water on the equipment or place them under running water. Before you do clean the equipment, always unplug the accessories from the power or remove the cables from the equipment. Only use the wipes provided to clean the equipment and related accessories. And always clean the equipment and related accessories before and after each use. Do not spray any of the equipment with any other cleaning reagents or other alcohol-based cleaners at any given time. If you follow these instructions throughout your time in the instrumentation lab, you will have a safe and enjoyable learning experience. If you have any questions, always ask a lab tech. And as always, the iBiomed team wishes you best of luck in the instrumentation lab.